So we're going to perform the head to toe assessment starting now. No, can I come in? I'm going to wash my hands for 15 to 20 seconds. Okay, so I'm going to be your nurse today. Can I see some identification? Can you tell me your first and last name?
Eric Perez.
Okay, Eric Perez, can you tell me your date of birth?
June 11, 1997.
Okay, Mr. Eric, we're going to perform the head to toe assessment starting with the head, looking for any sign of asymmetry. As I can see, your head is symmetrical. I'm going to start by palpating the head, looking for any nodules, any broken bones in the head. I don't feel that. You're good. After that, I'm going to palpate the temporal artery. Okay, I palpate the temporal artery. I can feel that the pulse is too close and bounding. After that, I'm going to assess the TMJ. Can you open and close your mouth? Can you smile for me? Okay, he was able to perform the TMJ correctly. He didn't have any problem performing that. After that, Mr. Eric, I'm going to I'm going to assess your eyes, starting with my finger. I'm going to assess your eye movement. Can you follow your eyes with my finger without moving your head?
Mm-hmm.
Okay, I assessed the eye. He was able to follow my command, and the eyes were following my finger at all time. After that, I'm going to get the pen light and assess for pupil reaction to light in the right side, then in the left side. He was able to the eyes are reacted to light at 3 plus breast. After that, I'm going to get the ophthalmoscope in the right side and look in the right side, looking for any macular degeneration, retina detachment, any signs of artery degeneration. And then to the left side. Okay, I didn't see any eye problems, any signs of blindness in the eyes. After that, I'm going to continue to assess the ears using the ear speculum and assessing the tympanic membrane. Okay, the tympanic membrane is intact. I didn't see any ear fullness or any discharge. After the ears, I'm going to continue to the nose, assessing the nose, assessing for any sign of septum deviation or any sign of turbulent problems. I didn't see any sign of nose deviation, and the turbans are normal size. After that, we're going to continue to the mouth. Can you stick your tongue out? Okay, the tongue is pink, the lips are pink too, the gums, I don't see any signs of bleeding in the gums, and the uvula is in mid-size. After that, I'm going to palpate the thyroid gland, starting with the right side, then the left side, anterior and posterior. While palpating the thyroid gland, I feel that he didn't have any masses or any enlargement. After that, we're going to continue to assess the lymph nodes, looking for any masses or any enlargement, starting with the preauricular, the postauricular, the occipital, tonsil, then the submandibular, the submental, anterior, posterior, and the subclavicular. While assessing the lymph nodes, he didn't have any signs of enlargement or any problems in there. After the lymph nodes, we're going to assess and percuss the carotid artery. We're going to start by percussing the carotid artery. Okay, I can feel it. It's too close and bounding. Then I'm going to auscultate with the bell, the carotid artery. I'm going to place the stethoscope. I'm going to get the bell. Okay, I hear it. It's too close and bounding, and the pulses are strong. After the carotid artery, we're going to start with the chest, the heart. In the heart, I'm going to ask the patient to sit in a 30 to 45 degree angle, and I'm going to start by assessing the pulses, starting with the radial pulse. Okay, it's too close and bounding. In the other side, bilaterally, too close and bounding. Then in the dorsalis pedis, too close and bounding, and the posterior tibial, bilaterally, too close and bounding. Okay, so the pulses are strong and too close and bounding. Then after that, I'm going to get the stethoscope. I'm going to auscultate for the lung and the heart. I'm going to start with the diaphragm. We're going to use the diaphragm for this and the bell too. I'm going to start by auscultating the aortic, moving out to the pulmonary, then herbs, then to the tricuspid and the mitral. As I was auscultating the heart sounds, I can see that the S1 is best heard between the tricuspid and the mitral, and the S2 is best heard between the pulmonary and the aorta. After that, we're going to continue with the chest and lungs. In the chest and lungs, I'm going to start in the back of the patient. Can you stand up, please? To percuss the costovertebral angle. Do you feel any tenderness?
No, sir.
Okay. As I was assessing the costovertebral angle, he didn't have any tenderness. Then after that, I'm going to auscultate the lung sound, starting in the posterior side. Can you take a deep breath for me, okay? Breath through the mouth and exhale through the nose. One. Again. Okay. Now I'm going to go to the anterior. I didn't hear any advantageous sounds. Going to the anterior. Again, can you breathe through the mouth? Side. Now I'm going to do a lateral. While assessing the lung sound, I didn't hear any advantageous sound. He was able to breathe without any problems and without on-label problems. After that, after the chest and lungs, we're going to continue to the abdomen. I'm going to stand in the right side of the patient and I'm going to put the patient at 30 to 40 degree angle again. I'm going to start in the abdomen by auscultating the 4 quadrants, starting with the right upper quadrant, then left upper quadrant, then going down to the left lower, then right lower. After auscultating the abdomen, I didn't hear any sounds, any hypoactive or any hyperactive sounds. Then after that, I'm going to auscultate the vascular sounds, starting with the aorta, going down to the renal, going down to the iliac, and going down to the femoral. I didn't hear any strange sounds there either. After that, I'm going to start percussing, starting in the right upper quadrant where the liver is. In there, I feel a dull sound, which is normal for the liver. Going in the middle for the aorta, going in the left upper quadrant for the spleen, and going all the way down to the left lower quadrant. After percussing, I'm going to palpate, light palpate and deep palpate in the right upper quadrant of the spleen, looking for any masses. Then on the aorta, then in the left upper quadrant in the spleen, going all the way down to the left lower quadrant. I didn't feel any masses, no rebound tenderness. I didn't hear any sounds. After I finish with the abdomen, I'm going to continue to the neural portion of the examination. In the neural portion of the examination, I'm going to ask the patient to move his head against resistance on my arm. Can you do it, sir? Okay. Okay, he was able to perform that procedure. He didn't have any problem in the neck. And now, sir, I'm going to stand up and show your shoulders up for me. Okay, so he was able to perform that procedure again without any problems. Now, sir, I want you to touch your hands to your knees. Okay, he was able to follow my command. Now, touch your fingers and your thumb. And in the next hand. Okay, so he didn't have any signs of here we're assessing ataxia. He didn't have any problems performing that procedure. After that, sir, I want you to touch your nose with one finger off, then touch my finger. I'm going to move moving around. Okay. He didn't have any problems performing that procedure. After that, I'm going to ask the patient to stand up and perform the heel to shin test, looking for any sign of ataxia again. Okay, he was able to perform that procedure. He didn't have any problem. Now I'm going to assess the reflexes, starting in the right upper quadrant with the tricep. Can you please put your tricep like this? I'm going to assess with the mouse. Okay, he has a strong reflex there. And now in the other side, okay, as you can see, he has a strong reflex there. Then we're going to go to the lower quadrant, and I'm going to assess the reflex in the legs. Okay, so he was able to move his leg when I touched him. In the other side, so he was okay. So he has Valerie. He has strong. He was able to move his legs when I touched him. After that, I'm going to continue. I'm going to get the tuning fork. I'm going to touch it. I'm going to put it in the big toe. I'm going to ask the patient if he feel the vibration. Do you feel the vibration, sir?
Yes, sir.
And go to the other side. Do you feel the vibration?
Yes, sir.
Okay, so the patient is able to feel the vibration. Now I'm going to perform. I'm going to get the toe. I'm going to move it around, and he's going to tell me in which position the toe is. Can you tell me in which position the toe is?
Up,
Now?
down,
Now I'm going to do it in the other side. What position the toe is?
up, down.
Okay, he was able to tell me where the toe is and the position of the toe. Now I'm going to ask the patient to stand up, and we're going to perform the rumble test. In the rumble test, the patient is going to close his eyes and stand in one leg. Okay, he has a negative rumble test. Then I'm going to ask the patient to walk in a straight line, touching his toe in a straight line. Can you walk for me, sir? Looking for signs. Okay, he was able to walk in a straight line, and now back, heel to toe, and now back, heel to toe. Okay, he didn't have any problem walking. He was able to perform the procedure. Now, sir, can you please sit down? And after this, we concluded the head to toe assessment. My name is Iran, and this is Eric, and it was nice. That's it.